Eka Kapotasana. The pigeon pose is one of the most popular yoga poses, and it helps release tension points and improve the range of motion in the hip joints. This pose requires particularly high mobility in the hip joint. Practitioners with a suitable natural structure and unusual flexibility can do it relatively easily. Still, in most cases, the hip joint structure does not allow the femur to use the entire rotation range and creates a break. Unsuitable or too aggressive practice can cause severe damage to the knee joint, as will be presented in the kinesiological analysis of this pose. The correct way to perform the pigeon pose step by step. Start on all fours and bring one leg forward with the knee between your hands. The front knee is bent in the sagittal plane. Take the foot away from the thigh to open the knee angle while keeping the pelvis centered. Notice how it creates rotation in the hip and knee joints. The back leg is straight in plantar flexion. Make sure to maintain the pelvis in the center. Inhale in this position while the chest faces forward and upward, turning the sternum flashlight around. The hands are placed on the floor to the sides of the knee. Inhale. With the chest facing forward and upward, the center of the chest bone faces forward. Exhale and descend slightly with the pelvis in the center without collapsing to one side. After a few breaths, slide the hands forward on the floor and rest your forehead between the hands or on the palms. The movement in the hip integrates flexion and external rotation. Pay attention to the tension created in the lateral band of the iliofemoral ligament, Y ligament. The stretched muscles are gluteus medius, piriformis, gluteus minimus, gluteus maximus. During elevation and thoracic extension, the back erectors contract and the iliopsoas muscles of the back leg are stretched. The movement in the hip integrates flexion and external rotation. Pay attention to the tension created in the lateral band of the iliofemoral ligament, Y ligament. The stretched muscles are gluteus medius, piriformis, gluteus minimus, gluteus maximus. During elevation and thoracic extension, the back erectors contract and the iliopsoas